Hi, this is Dr. Kathryn Dao, day 2 of EULAR 2022. I'm reporting for Room Now, and I wanted to share with you a couple of abstracts that had been presented. There's a whole reproductive session that I thought was amazing, and really I had hoped that a lot of people would have attended it. But if you didn't, the first one is poster 0705. The title of it is Dilemma Belimumab Therapy Discontinuation During Pregnancy, Results of a Retrospective Study in Vigilance. So if you don't know what Vigilance is, it's basically the European version of Otis in America. So that's where they collect all the data about babies and also the medications and try to figure out if any of the medicines can potentially cause harm. So the background here is that they wanted to look at patients with lupus nephritis, specifically with belimumab exposure. And currently, we're not quite sure whether or not belimumab is safe in pregnancy. The general consensus is that it is safe. So the Vigilance database sought to evaluate this. So there were 47 pregnancies studied. 37 patients actually stopped belimumab in the first trimester. That's called Group A. And then 10 patients continued their medication beyond the first trimester. And so what they did was they compared the two groups, the groups that stopped it and the groups that didn't. And the authors found really not much difference in fetal deaths, gestational age at birth between the two groups. They really didn't see like any issues with continuing the belimumab. But what was interesting was that in the group that had stopped the medicine in the first trimester, there might be numerically higher numbers of congenital malformation, preterm births, and low birth weights, though it's not statistically significant. So based on this study, the authors concluded that continuation of belimumab might actually be preferable in patients already on treatment. Now, that's in contrast to a different study, which is oral presentation poster 0129. Again, the Vigilance database. What they did was they compared Belimumab use with certolizumab. In fact, they compared all non-TNF biologics with certolizumab because certolizumab is considered the gold standard. It's the one TNF inhibitor biologic that actually is so large that it doesn't really cross the placenta. And so they did find that there might be a slight increase in the number of congenital malformations with belimumab, but really there was no like consistent pattern. So they think it's just probably noise. But what was interesting in this one study, though, was that they found 3 cases of corpus callosum agenesis. And so this is where the bridge between the 2 hemispheres of the brain didn't really develop well. And this was with vedolizumab, or you might know it with its brand name Entyvio. And so the 3 cases, 2 of them were from Crohn's patients, 1 from ulcerative colitis. And not only that, with the corpus callosum agenesis, there were 2 other CNS malformations associated with it. So possibly a signal. We're not quite sure, but something to pay attention to, particularly if you have any patients with inflammatory bowel disease who might be on vedolizumab and who is of childbearing age. So that's Dr. Kathryn Dao here reporting. Thank you for listening. Follow me on Twitter at KDao2011.